Good morning, I'm Matt Schaefer. Welcome back to the Boston Sunday Review. Chiropractic can be a positive addition and alternative to your health regimen. Dr. Eric Rosine from the Visions Healthcare joins us this morning on the BSR. Eric, nice to meet you and good morning.
Oh, thanks for having me, Matt.
So what is the role of the spine in a person's general health?
Well, the spine is kind of the core of all your movements, and it holds all the nerves, and it's a really important part of your body. So really what I see most of the time, I look at kind of back pain, neck pain, headaches. Those are all conditions that obviously relate to the spine.
Most people will know from experience that if you have a backache, it just sort of affects your entire body.
Yeah, it's true. I mean, we stabilize our spine and use our spine with every movement throughout our entire day. So it really can affect people's ability to work, to play with their kids. There's a lot of things that it makes a big impact on.
The spine is divided into three parts: the cervical, the thoracic, and the lumbar. Yes?
Yeah, and the fourth part would be the kind of the sacrum and the pelvis, sometimes included in there.
Are the parts different, and do they have different functions?
Yeah, they're different. So the joints of the lumbar spine versus the cervical spine, they have different orientation. So they move differently. Like your mid-back doesn't rotate as much as your neck does. Yeah, so they have different purposes, and different types of muscles have different purposes. So yeah, big difference from your low back to your mid back to your neck.
And then there are the vertebrae. What are they and what are their roles?
So the vertebrae are the bones of the spine, right? So you've got the bones, that's the structure of the spine, and in between the vertebrae you have the discs, which are kind of the squishy support that is between each level of the spine.
And so what do we mean when the spine becomes misaligned?
Yeah, so actually I don't, misalignments of the spine, I don't really think of it that way. I think of, it's an easy analogy, right? But I think of the spine as having healthy movement. So sometimes the spine has an injury and you get restrictions of the joints. And, you need healthy movement at every segment of the spine. So you don't want those restrictions.
So you want the spine to be movable, pliant?
Yes, you want healthy movement, and you want lots of it.
Can sitting in front of a computer impact your spine?
Oh, yeah, of course. I mean, and we live in a city where a lot of people have desk jobs. They sit in front of a computer all day, and then maybe they go home and watch some TV or sit some more. And when you're sitting, your hips are flexed and your hip muscles can tighten up, and a lot of those muscles start at the spine and can really stiffen up and cause you to have a tight back.
And what about lack of exercise?
So exercise is kind of the opposite of sitting or being sedentary. It helps keep things limber and keep things strong and flexible. So exercise is totally necessary for someone who has a desk job to kind of keep balance in their lives.
What about poor posture?
Well, poor posture is something that we all kind of have a tough time with, but as we kind of lean in towards our computer screen or let our shoulders roll forward, that can kind of change our alignment over time or change our ability to have healthy movement. So, really thinking critically about how your computer is set up. Maybe you have a standing desk or something that can help you have better posture is really key.
Is poor posture a result of spinal problems or a cause of spinal problems?
That's a really good question. I think if you have an injury, that can change your posture. You can have what's called antalgia. You can be standing in a different way because you've got a back pain or you've got a neck pain. And if that's not addressed properly, if you don't get that flexibility back, or it takes a long time, that can certainly change your posture. On the flip side, if you have a job that demands a lot of your posture and you're not kind of mindful of your alignment, and you kind of do lose some of that proper posture and you become stiff over time, that can certainly lead to back and neck pain.
So you don't like the term spinal misalignment?
I don't usually use it. It's certainly something that I understand and talk to patients about. And maybe some joints can kind of shift, and it's a good representation. But I think a better term is spine restriction or joint dysfunction. I think that more accurately represents what's going on.
So, what are the signs of spine restriction, and must you necessarily be in pain?
Yeah, so you talked about someone who has poor posture. They kind of lean forward, maybe their shoulders roll forward. They're spending a lot of time flexed forward, if you can picture that. So they're probably restricted through their mid-back and maybe their neck too in extension. Meaning they're not using their extension, so they're probably stiff in extension. So they might not feel a lot of pain there. They might feel some stiffness, but not necessarily pain. But, if someone has a new injury, they might have tenderness to pressure of the joints, tenderness to movement. So that would definitely be associated with pain.
So you could also have it, though, and not feel pain?
Yes. I think people are walking around all over the place, and they've got limited motion in certain joints and restriction of certain joints, and they may not feel it. It may not impact their activities of daily living right now, or they might just kind of live with it and avoid certain activities.
Chiropractic has had sort of an interesting history. It began at the turn of the 20th century, I believe, and was rather controversial and has now been embraced by the American medical establishment. What is the concept of manual manipulation?
So chiropractic has changed a lot in the last 100+ years, and I think part of the reason that it's become so accepted is because low back pain and neck pain and some of these other musculoskeletal conditions are just really tough to treat and can be frustrating for kind of the medical profession and any healthcare provider to treat. So what manual therapies are, or manual manipulation, they can be for joints, or it can be for the soft tissues. We talked about a joint being restricted, so trying to find ways to use hands-on therapies or manual therapies to kind of restore that range of motion. Or if a soft tissue has knots or spasm or scar tissue or things called trigger points, trying to reduce those changes to the soft tissues that can be associated with pain.
I would argue that part of the reason that it's been embraced and accepted is because it works.
Yeah, it does work. You're right. There's studies that it works. There's studies that patients are really satisfied with their experience, and chiropractors have really high approval rankings from people that are surveyed, and it's relatively a low cost compared to a lot of the other treatments that are out there. So for those reasons, that's a big part of why it's been embraced by third-party payers and by healthcare providers. So, yeah.
So what is the goal of chiropractic care?
So chiropractors, probably the first goal is to, assess a patient and to come to a diagnosis like any other provider to see, if it's something that can be managed with conservative manual care. Like a sprain or a strain or joint dysfunction, or if it's something a little more serious that might need more intervention. So
you work at kind of a unique practice that includes MDs and alternate healing experts.
Yeah, Visions Healthcare is just a wonderful place, and there's not many places like it. It's got a lot of primary care. That's kind of the focus. But at the same place, people have access to chiropractic and acupuncture and physical therapy and dietitians. So really, we're a team. We're a team, and patients get a benefit from that.
What are the primary reasons people come to see you?
So for me, back pain and neck pain and headache are the three most common things that I get referred to me, often from the primary care docs, and that's certainly what patients or that's what the public seeks chiropractors for most commonly, are those three conditions.
Do they come to see you because they're suffering these symptoms individually or in some combination?
I think back pain is common. So people have an episode of back pain and they come in for that, or people have an acute episode of neck pain and they come in just for that. But you talk about posture and you talk about maybe someone who's had pain for a longer period of time. They can have back pain, hip pain, neck pain, all kind of at the same time.
How does compensation, or the body's efforts to compensate for pain, end up impacting on the condition?
So I think it's the body's compensation and sometimes people's adaptation to just pain in general. Sometimes, this is one of the biggest challenge of treating low back pain for any healthcare provider is people can be fearful of their pain. People can stop moving, they can stop exercising, they can really limit themselves, and all of those things are connected with poorer outcomes. So really, if people are modifying their activities because of pain and they're losing flexibility and becoming stiffer because of that, that's a big challenge. And I try to, work with people on that all the time.
So if your neck hurts and you start holding yourself in a way to protect that part of your body from hurting, the next thing you know, your shoulder could hurt, or your lower back could hurt, or you might be suffering headaches.
You could have a headache. Yep, you got it.
Do you battle the stereotype that you primarily work on back and neck?
Well, in a large part, I embrace it because I think that's where I add a ton of value to healthcare. On the other hand, I also, I am a medical volunteer at the Boston Marathon. I, work at the Golf U.S. Open and a number of other kind of athletic venues where I work with other types of sports injuries, which really largely also are soft tissue injuries and other joint, upper extremity, the arm, and the lower extremity, the legs. So, other musculoskeletal injuries, I also really enjoy seeing those.
Can anyone come and see you?
Yes, yeah. Chiropractors are portal of entry providers, so they don't need a referral. You don't need a referral to see a chiropractor. And, most insurance companies, at least certain plans, have a chiropractic benefit. So, comparing today to 20 years ago, chiropractors are much more accessible.
So you can work on kids?
I can. Being at a place like Visions is great because there are some doctors of osteopathy there that, they like working on kids a little more. I'll work on teenagers all the time, but for real young ones, I'll probably refer them to other parts of the team.
Seniors,
yeah, all the time. Yeah, I think the oldest patient I've worked on was 97 years old.
What if you're pregnant?
Oh, there was a study a couple of years ago where at Washington University combines usual care for pregnant women along with manual care from a chiropractor, so exercises and mobilization of the spine, and outcomes were much better. They slept better, they had less pain, they had less interference of pain with their daily activities. So yeah, I really enjoy working with future mothers.
When we come back, pun intended, we'll tell you what happens when you visit the chiropractor. I'm Matt Schaefer, and you're listening to the Boston Sunday Review. Good morning. I'm Matt Schaefer. Welcome back to the Boston Sunday Review. Our guest in the studio is Dr. Eric Rosene from Visions Healthcare. He's a chiropractor, and we're talking about chiropractic and how it can help you with your health. Eric, I'm curious, when someone comes in to see you, how much of your diagnosis is first observational? Is the patient's carriage, how he holds or she holds themselves, important for you?
Yeah, I'm always looking at how people are walking and how they're holding themselves. It's always a good sign if people are in a normal posture or they don't have any alterations, which is called antalgia. And certain types of antalgia or how they're holding themselves is indicated of things like disc herniation or sprains or strains of the muscles and ligaments. So
I'm curious how many people come into your office who have good posture.
I think we all struggle. We could all do better. That's we're fighting gravity, and we're fighting our desk jobs or whatever other kind of repetitive things we do at work or in our hobbies. So yeah, everyone has something to work on, but some people have worse posture than others.
How much of your diagnosis is anecdotal based on how the patient describes his or her complaint or symptoms?
I think for any condition, a thorough history is the most important thing. You can learn a lot about how the pain came on, kind of where they have the pain, where it radiates to. So that's probably the most important thing is kind of their story, their condition, and what they tell you before, I do any hands-on evaluation.
How much is of your diagnosis is based on touch, how the patient feels under your hands?
Yeah, so that's, I think, one thing that chiropractors really excel on. They do put their hands on patients and kind of they have a good sense of what muscles, tendons should feel like and how joints should move. And that can be really revealing to kind of the specific nature of a acute low back pain or acute neck pain.
Do you use x-rays or any other sort of technical diagnostic tool?
Yeah, so I do use x-rays when necessary. If someone has a trauma or after a car accident, there are some times when x-rays are good, but we're finding more and more that for 80 to 90% of low back pain, x-rays aren't really that helpful and won't change treatment, and it will expose people to radiation. So I think people who treat a lot of low back pain don't use x-rays that often.
So what is a chiropractic adjustment?
So chiropractic adjustment or spinal manipulation or spinal mobilization is a very similar thing, and that's a way to get to kind of gap a joint or get a joint to restore its full range of motion.
How do you determine where to adjust?
So there's something called motion palpation, where you feel how the joint is moving, and then you maybe move the body part through its range of motion, and then you compare that. The spine's a little easier because you can compare that to the spinal segment above or below. So with time and with practice, you really get a feel for how certain parts of the body, certain parts of the spine should move, and for certain cases, it's very clear what joints are not moving.
How important is the bench, or is it a table?
So the chiropractic table that people use on is really helpful for the examination. It can be a kind of a comfortable place for people to lay either on their stomach or their back. And there are certain tables, that I use a table called a flexion distraction table, which allows the table to the tailpiece of the table, or where people's legs are, to kind of move up and down, and that gives me really great ways to stretch the back, which can be a really mild treatment.
So you can actually use the table to adjust the patient's body.
Yeah, there are really gentle ways to that I'll often use before I do other types of manual work that really involve the movement of the table.
Does the position of the patient impact the adjustment?
Yes. Yeah. I mean, sometimes people have a bias. They'll actively move one way and it'll feel good, and they'll actively move the other way and it'll feel really bad. So often we try to kind of predispose people to a position that feels good, and it makes for a more comfortable adjustment.
What makes the cracking or popping noise?
It's gas. So you have gas that's dissolved in the fluid of the joints, the synovial fluid. So when you move a joint through its full range of motion, at some point towards kind of the end of its range of motion, the gas separates from the fluid, and that process creates the noise. So it's a sign that people have healthy, hydrated joints. So in a younger person, you would usually expect to hear that. In an older person, someone who's 80 or 90, it might not make that noise.
So not every adjustment is accompanied by a crack.
That's right.
I'm just curious, in your own personal experience, when you're adjusting someone, is it do you characterize it as how deep you go, or is there a level of adjustment that you in your own head are looking for?
Adjustments are meant to be very shallow. You want to be very specific and very shallow, just to get that extra bit of motion that someone may have lost over time or with acute injury or muscle spasm.
Do you use electrical stimulation?
Very rarely. Sometimes it's useful if someone has a lot of muscle spasm. It can kind of break that cycle of muscle spasm. But a lot of research has been done to say that electric stim is really not that helpful for many people.
What is active release technique?
So active release technique is a kind of a anatomy-based soft tissue technique developed by a chiropractor, and it you really got to feel it to know what it is, but it's something that a lot of endurance athletes, triathletes have really come to use a lot. But active release technique, the most simple definition would be you would get in on a tight muscle or a tight part of a muscle while it's in its shortest length, trying to find that spot while the muscle's in its shortest length, and then you would stretch or have the patient actively move that joint so that the muscle lengthens. And in that you can break up scar tissue, break up muscle spasm, and it's a really effective technique for a lot of people with back or neck pain or some sort of sports injury.
So the patient is not passive. The patient would have a more active role in his or her treatment if you were using active release technique.
That's right. So, I mean, so you go back to electric stim, it's very passive therapy. I think that's why people don't really like it. But active release technique is involving movement. It's kind of a rehab with soft tissue work. So it's a great combination.
How about Graston technique?
So Graston is kind of another permutation of ART. This is what's called an instrument-assisted soft tissue technique. So there's a set of these stainless steel tools
that look like they're out of a horror movie.
They look quite interesting, and I usually let people kind of see them, hold them before we do this work, because it's maybe not what they first expected when they came to see a chiropractor, but it can be really effective for someone who's had kind of a chronic injury that's very specific, a chronic tendon injury or tendinopathy. It really gets at scar tissue and breaks it up.
It breaks up scar tissue, right? It's sort of like a deep massage using an odd metal tool.
Yeah, so it's very therapeutic, but also the metal tool really kind of resonates the texture of the tissue. So, kind of looking to see if the tissue feels smooth, and for the patient if it's pretty comfortable, versus if everything's really tight or in spasm, everything will feel very firm, versus if you find what's called an adhesion, which feels like this gritty patch that you just kind of want to break up, and that is often makes a huge impact on the person's pain or condition.
How about functional and kinetic treatment with rehab?
So that's another progression. So we talk about ART using working on the soft tissues with movement. Graston, at its kind of basis, is using this tool, sometimes passively, and the last thing you mentioned, factor, is kind of combining those two thought processes. That you're going to use this tool, and then you're going to combine it with movement. So someone who has like a calf injury, you're going to work on it passively, then you're going to work on it engaging the calf, then you might have them weight bearing, and then you might have them do that same activity while you're using the Graston tool in a sports specific way.
What can a person expect on the first visit with you?
So a pretty thorough history and evaluation usually takes about 30 to 40 minutes. And then usually, if it's a person's good for treatment and wants to continue with treatment, we'll do a treatment which takes about 10-15 minutes.
How long before you see results?
You try to see results as soon as possible. For some people, that's a couple times a week. For 1 to 2 weeks. For other people, it may take a couple times a week for 3 or 4 weeks. But that's kind of the range of how long I see a patient.
Is chiropractic treatment ongoing afterwards? Can regular care prevent injury?
So in general, I kind of treat people and send them on their way with a lot of self-care strategies. So I encourage them to maybe do yoga or use a foam roller, do specific exercises or stretches. But some people who have chronic conditions or chronic recurrent conditions can, maybe once a month, they'll really be able to control their symptoms if they continue care.
For the person listening to us this morning who may be suffering from back pain, how important is something like stretching?
Yeah, so stretching is good. I would say that yoga is maybe a better option. You think about all the things that come into play with back pain. It's not just tissue tension. Sometimes it's stress plays into it, or anxiety plays into it. So yoga's this really kind of age-old practice where people have time for maybe meditation, maybe rhythmic breathing, certainly stretching and core exercise. So it's a pretty dynamic activity that contains stretching, but I think would be better than stretching alone. How
about a good mattress?
Yep, that's something that's very variable from person to person. Generally, a firmer mattress is better for the low back, but maybe not better for the neck. So people really gotta maybe go to the hotel a couple times and find a few different mattresses and see what works best.
How dangerous are backpacks, shoulder bags, and purses?
You don't want to be carrying around anything too heavy, and if you have to carry out anything, maybe a backpack that's equally distributed from side to side. So yeah, that's another thing that you can kind of fine tune and try to keep as light as possible.
Well, again, folks can learn more about you at visionshealthcare.com. You work at a really interesting practice with a whole bunch of interesting people. Dr. Eric Racine is a chiropractor from Visions Healthcare. Thanks for joining us this morning,
Oh,
Eric.
Thanks for having me.
Thank you for joining us as well. To learn more about upcoming guests and shows, you can connect with the BSR on Facebook and Twitter by going to cbsboston.com/connect. I'm Matt Schaefer. Thanks for joining us. You've been listening to the Boston Sunday Review.